I'm Dr. R. Rajakrishnan, working as an assistant professor at SNS College of Physiotherapy. These are my students. We are now going to discuss about the stretching in the exercise therapy. They have learned previous year, and we are going to share our knowledge through this. She is Achevashri. She is going to start this. Yes, Achevashri.
Okay, stretching is a therapeutic exercise technique. It is used to lengthen muscles and soft tissues. It plays major role in our field, physiotherapy, sports, and rehabilitation.
Yes, the stretching is the most important part of the physiotherapy. We are going to do stretching in any kind of the ways. Okay. Yes, Vishnuraj.
Hi, I'm Vishnuraj. I'm going to say about why stretching is important for athletes and gym goers. Stretching is a crucial component for fitness and routine.
Yes.
Primarily, it gives muscles health, strength, flexibility, and enhance muscle strength.
Okay.
Next, it's going to prevent the injury.
Oh, okay, super.
Thank you.
Then the gym goers and athletes are doing the stretching because of these reasons.
Yes.
No, sure. Yes, Keshavanandi.
Hi, I'm Keshanoni. I'm going to tell about the types of stretching. There are many types of stretching: active stretching, passive stretching, static and dynamic, PNF technique, and isometric stretching. Active stretching means a patient actively stretch their muscle, and then passive stretching means a therapist help the patient to stretch their muscle. Thank you.
I'm going to continue the types of stretching. There are few more types of stretching. Ballistic stretching. Ballistic stretching is a rhythmic oscillatory movement given to stretch the muscle. Another PNF technique. PNF stretching. It is used to activate a stretch stimulus in our muscle. It's used to stimulate the stretch stimulus because the rehabilitation process will be easier in our process.
It reflexes the stretch reflex. It initiates the stretch reflex, which is more important to strengthen a muscle while doing a PNF for a neuro patient. Yes. Yes, Alan.
Total stretching time is about 10 to 15 seconds. If the stretch time exceeds 60 seconds, muscle will be completely tired. So there will be no use in giving stretching to the torn muscles.
While doing stretching, what are the physiological effects underlying in the muscle?
Stretch reflex.
Okay.
And
also
the soft tissue extensibility.
Starts to differentiate.
Yeah.
Yes. Yes, Karan.
Hi sir, I am here to tell about the indication condition of the stretching. Here we can see the indication like muscle spasms and spasticity and joint stiffness, and contraindication like bleeding, open wound, fever, and some other conditions.
Okay. You are not going to give stretching for the hyperpyrexia patients.
Yes sir.
Then recent injury or recent surgeries, we are going to avoid it. Then what all we are going to do in the stretching means we are going to give the stretching in the cool down effects.
Yes, sir.
If we are going to give the stretching in the cool down, or the
And
next
easier
day
for the
the patient or the athletes is going to make the exercise very brisk, because the stretch when the stretch is given, the muscle gets more blood, so the blood relieves the pain, and it enhances the muscle to do another activity the next day. Okay, Karan Prasad. Then we are going to see about the case study, whom we are going to give the stretching in the next part of the video. Thank you.
Hi sir, I am here about one doubt sir.
What is the doubt, Kavinraj?
Why we cannot give a stretching before the exercise?
Yes, I already said that the stretching should be given after the exercise in the cool down because if we are going to give an stretching before the any activities, any games, the muscle will go for a tear. And also another reason is that if you are going to lengthen a muscle, after that you are going to strengthen the muscle, means it is very tough time or a tough thing to give. For example, if you are going to bend a length rod, it is very difficult. If you are going to bend a small rod, it is very easy for you. So same reason applies this also.
Thank you sir.
Sir, I too have a doubt in stretching.
Yes.
Is stretching before exercise is good or after exercise is
Yes, I already said that before the exercise only it should be given. Before after the exercise only it should be given. Before the exercise, if you are going to give a stretching, I already said the muscle is going to an elongated position, and also it goes for a micro tear. After a tear, the muscle can't able to strengthen more. So we are going to give it as an after exercise protocol, like in the cool down. The warm up is different and the stretching is different. Okay.
I also have one doubt.
Yes, Mr. Raj.
Can you give stretching to the geriatric patients?
Yes, we can give the stretching for the geriatric patient, but in some cases we are unable to give the stretching because the geriatric patients will have a floppy muscle. The muscle mass will go for reduction. If you are going to give a bending to the same example, the bending to a very soft particle, the bended material will go for a breakage. So if you are going to give a stretching for a geriatric patient, the muscle may go for a tear. So we can give, but we have to give it for a very mild stretch if they are needed really. Okay, this is a good session and we continue this as a case study in the upcoming videos. Thank you.